One was asking is like, how does the total artificial heart actually feel inside you compared to just a normal heart? Does it like have a different sensation, something like that?
No, no. The like on the driver when it would they adjust the beat to however many beats, to where they want to keep it at. Mine was kept around 132, and it would creep up to 135, 136, and then they would readjust it. You really couldn't feel much there. But if I changed drivers, if we switched, the drive unit, you could feel it. It'd feel like say if you were swimming and you were coming up to the top of the water and you're almost out of air, that little hiccup type feeling. Um, it was the same way with the defibrillator. When they adjust the defibrillator on the laptop, it's just like a flutter. You just feel like a little flutter.
Okay. So it's like a little transient thing and then it kind of
Yes, yeah,
feels more.
that's a
Yeah.
great way to put it.
Yeah.
Hi, thanks so much for giving us insight into your story, Johnny. It's you have quite a remarkable, I guess, take on life. I think taking on a situation like this with such optimism. I'm just wondering from I guess, more sort of the practical everyday things that you would do in your everyday life with a total artificial heart. How did that really change? Were there any challenges such as showering or sleeping I mean, I'm assuming there would be some adjustment to that. Do you have any sort of anecdotes or stories about, I guess, things that happened in some of those everyday things that you would do every day?
Shower, I couldn't shower for the first probably 12 weeks because where the drive lines come out, it's an open hole.
Hmm.
And so you have to keep it clean and dry and everything. After it heals, they told me I could wrap cellophane around and then I could shower, just keep the drive outside. I never did though. I figured nobody told me I stunk, just by doing sponge baths and stuff. So I didn't want to take a chance of infections or nothing. So I just kept doing what I did. Sleeping, what I would do is I would put a little step stool next to the bed and set the driver on that. And then that would give me more leeway on the drive lines itself, where you could turn and roll over and whatever. And then I would plug into the wall. So I didn't have to change batteries or nothing like that. It would just be continuous. Don't like I said, the only really hang up I had was when I get caught up on a door. I'd walk by a door and it would catch the handle, kind of pull. My grandbaby, when she'd sit next to me, she would hold the drive lines and it had a little vibration to it. So when she was a baby, she would just hold it and it would put her to sleep. Well, when I came home from the hospital after transplant, she climbed up and she's sitting on my lap and she's reaching for the drive lines and they weren't there. She looks up and gives me this look like, wait, something's missing. But no, that's really about it. I'd go to restaurants and I'd call make reservations, table for five with the plug. And it kind of freaked them out at first, and then when I got there, they wouldn't know why. I'd plug in, wouldn't charge. But as far as everyday activities, I I could do everything. I mean, everything except getting into water,
Hmm.
the beach and stuff like that. But everything else was free to go.
Thanks so much for those insights. I guess
Wow.
one additional question,
Sure.
your family or the people that you live in, that they would have to deal with this new reality as well. Were there any sort of particular reactions from them or any challenges?
Um, they were all trained to help me change the driver when the driver went off. Um, my dad had to do it one time, and my son did it a couple times. Um, but as far as that, no. The noise, everybody says it turns to white noise. It don't. It don't turn to white noise. You hear it, I mean, but it's something that you get used to. It didn't, I could sleep with it. My wife slept with it. It's just something you get used to. It doesn't go away. I mean, that's for sure. Um, I, to me, that's the least of the problems.
Hmm.
I mean, without that noise, I'm not alive.
No, true.
Uh
I'm
huh.
just really interested. How long was it between the THA implant and you moving on to the Freedom driver? So how long were you on the C2 driver for?
Only in the hospital, about 2.5 weeks, and
And so,
and that 2.5 weeks. Well, I'd say 3 weeks, 2.5 to 3 weeks. It could have been a little bit less, but they wanted to keep me in because I had some bleeding, and it was nothing to do with the TAH itself.
and I noticed in one of the images that you showed us, there's a picture of yourself holding the handles of the C2, and there's a critical care nurse, I would guess, that's holding the other set of handles on the C2. How did you interact with the C2 hospital driver then? Did you go for a walk with it like you're supposed to, or did
Every
somebody
day.
else push it? And
Nope, I pushed it. She was just taking me to the OR. Yeah, that
and
was
as you moved into different kind of locations in the hospital over that 3 week period, did you find that there was an entourage that was with you to begin with, but eventually you'd kind of more or less go with only one person
one.
as a
Yeah, no, one. So sometimes the nurse and CNN, but never no more than two.
Oh, okay, cool. And just one more quick one as well.
Sure, no problem.
When you think of your time on the Freedom driver, if you had the chance to improve something, what would it be?
Um, Size. I mean, it was 13 to 15 pounds, with the
Yeah, okay.
battery, and I always took two. I always had a backup with me. Um, but versus anything else, um, no, that's it. I mean, I was comfortable. I was never uncomfortable. I was never in any pain or anything like that. It wasn't heavy enough where it bothered me. I've talked to people that I used to wear it like a backpack. A lot of people just carry it on their side or on a little like a suitcase
Hmm.
pull. But that's about it.
No, cool. Thanks very much indeed.
Like, how did it feel the cords getting caught in like a doorknob? And were there other situations or common situations where them drive lines would get caught?
No, just on the door, on the handle, and it would feel just like say if you were walking and oh, you were carrying a backpack, and you had it just on one arm, and the other side caught something as you're walking that pull. It wasn't like it was pulling the driveline out of my stomach or nothing. It was just like drawing you back.
Okay.
As far as other driveline issues, no. I know some doctors did them in different places. Dr. Ramsey, he liked to do his on the side. I've seen some where they do more towards the middle of the abdominal. But that's really about it because they give you enough cord or enough tubing to like when you take it off in the car, you can set it next to you or on the floor or whatever.
Okay. How long does like a normal charge last you in like everyday living versus maybe during
Three,
exercise?
about 3 hours, 2 to 3 hours. I tried to change them. When I had one light left, I would change them out. I never let it go all the way. But it gives you a warning, when your batteries are getting low.
Okay. And like,
I had some fun with it too. I mean, I'd be at the hospital visiting somebody, and the nurses would ask what it was, and I'd tell them, and then I'd say, I'm not feeling well. Can you check my pulse? And so they'd come over and they'd, check my arm and go down to my ankle, and you can see the concern on their face, and then I tell them, I don't have a pulse, and that would really kind of freak them out. I even had a doctor do an EKG. He just wanted to see that straight line, I guess. I don't know.
um, I mean, from your perspective, do you like what things do you think are the most important to improve in the device for a total artificial heart to make your experience better?
The driver, um, it's hard to say because my experience was great. I lived, you know what I mean? Uh, um, to 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 change something, the size of the driver, maybe this the noise, the um the sound, that's something that I hear a lot of from patients and nurses, and more from the nurses than the patients. But again, it's our heart beating on the outside and everybody else's heart beating on the inside. But as engineers, that would be something to really to work on, would be the sound.
Thanks. Hi, Johnny. Thanks so
Hello,
much
sir.
for taking the time. It's been really interesting so far. I
Yeah.
guess I just was curious about, the amount of advocacy you do and the foundation and everything. Are you seeing an improvement in the rate of awareness and perhaps a likelihood of clinical teams to take up this therapy as an option? Or are there other things that could be done in this space to sort of improve the likelihood, I guess, of clinical teams taking the THT, I guess, as a therapeutic sort of option?
Um, I think the more knowledge we get out there, I think that the more the therapy will be accepted, um, patients and physician wise. There's just I find more of the younger doctors more interested than the older physicians. Um, as far as patients, I think it has to be um, explained, talked about a little bit more, because when somebody is sick and really sick, and then you throw this at them, it's really hard. I was working with a gentleman not too long ago from Texas, and his case was so much like mine. And they told him just to go home, get hospice, and pass. And somebody had gave him my information. He reached out to me, and we talked, and he was interested. And then he just he says, I've already got hospice set up, and I don't think I want to be in the hospital anymore, and I think it's just time to go. And that was one of the hardest things that I've had since I've started doing this, because I've never had anybody give up like that. And I feel if he would have had this option prior to them telling him all that, I think we would have had a different outcome. I really do.
So the question here is, did the doctors know how long it would be until you received a donor heart when you received your total artificial heart transplant, and how
No,
long you could have continued on the total artificial heart?
no idea. Um, I could, our organ procurement gives you a 1 month window where you can stay in the hospital for 30 days, or you can come home from the hospital in 30 days, and you could be like status one, you can be on top of the list only one time. And so I didn't do that. I wanted to save that until I got desperate. But as far as I seen people that were on the TH, and I talked to people that were on the TH quite a while. I was on, my total days were 203. I've talked to people that were at the 300. So I no, I wasn't really concerned about that because like I said, I was living. I was with my family. I wasn't in a hospital bed. And that's the difference with the TAH. If you're sick and you're just sitting in the hospital and you're in the hospital for 6, 7 months, 8 months, that's wasted time. And you have the artificial heart. You're out with your family and everything else. You're living life.
Another question here is, I know there were times you needed to be assisted with your device. However, do you think you should have received training on how to use it when there was no one there to assist you and what to do in an emergency?
Um, yeah, well, you do because they do one-on-one training with the device. I could have probably done it by myself. Um, because all you're doing is you're changing the two drive lines. There's little snaps on them. You pull them both off and then put them back on at the same time. In an emergency situation, I think I could have did it. Now, do I think everybody could have done that? No. I think that a lot of people would panic. And if you panic, that's when the problem would come in. And that's one thing I had mentioned. I think everybody should do a driver change in the hospital before you leave. A family member or something, just not the nurses, just so you do it in a comfortable environment.
Was there anything you didn't get briefed on and thought would have been good to know about?
Mm, no, no, they did a really good job on that. Um, Not pertaining to the TAH though, but after transplant, one of the things that they briefed my family and stuff on uh, was the meds. The steroid, you're on a lot of steroids when you come off the transplant, and so the steroid rage it's real. So a lot of people that don't get that notice, all of a sudden, man, their loved one's going crazy. And my family, like my boys and stuff, I get mad, start yelling. They just say, "Well, it's just the meds," that would make me even madder. But it's there. That's one part of transplant, and that's the same thing with our nonprofit that we try to help with the TH patients too, is the meds because meds are important. Meds are important.
In relation to both in the hospital, but also when you come home, I mean the device, the drivers in the different situations display different information. Was there any of that information on the displays that you found really useful that you would check all the time, or was it much more about just the audio input that you would get from the devices that would make you interested, I guess, in what's on the displays?
Right. The hospital, the C2 driver, that has everything. I mean, that's just like a regular laptop size. On the Freedom driver, you just have a little, maybe a half-inch monitor across the top, and then you can tell your rates per minute, or beats per minute, and your battery life and stuff like that. And to me, my main concern was the battery. That's it.
So really, in practicality, when you got home, that's all you cared about, unless there was an alarm, I'm assuming.
Right, right. And I had chargers where I could charge it in the car, the cigarette lighter charger. I always had two sets. Um, Made it very easy to keep charged batteries.
And is it a thing? Do you, I mean, the thing we all carry around that has batteries are phones, right? But it's not
Right,
necessarily that it's something you check battery levels on that all the time. I mean, I think we've all had our phone run out of us. You don't really want that to happen with your
right.
with your total artificial heart. So did it become something that you actually checked a lot, or did you just get used to it and
Yeah, you get used to the time frame, or you'll hear that first beep.
Yeah.
and then change. And it's like when you're changing your battery, you can take one battery out and it'll continue to run, and then you switch them out. So you're never at that spot where it's going to stop.
All right. And there's nothing that you feel like you missed that you would have been interested in seeing on displayed?
No.
No. Okay. Thanks.
I'm really interested in how you lived with the C2 driver, particularly the hospital card.
Mhm.
Can I ask, like, I assume that you were in ICU rather than just on the general ward.
Oh no,
and-
step down,
all right, okay.
regular floor. Uh-huh.
So did the hospital car kind of, as it were, live next to your bed?
Yes, sir.
When we look at that image that you showed of the numerous IV pumps and IV poles and more bags of saline than you can shake a stick at, did anybody find that the C2 driver was kind of a piece of equipment that was in the way, even though it was the thing that was keeping you alive? What was your impression of the C2 driver when you were on the ward, as it were?
No, I don't think so. Um, it's I think it looks bigger in the picture than it really is. It's wider lengthwise than widthwise. But it could be next to the bed. I could get out of the bed. I could push it to the restroom. Um, it's very, very mobile.
And did you always find that there really was a plug socket available wherever you went, or?
Oh yes, yes. And then what they do is you talk to your local fire department. So if you ever have a power outage at your residence or place of business or whatever, you can go to the fire department and they're already aware of you. The power company, you let them know. So if there's ever an outage, you're one of the first houses or
Yeah, okay.
buildings that get put back on. I had that happen. We had a power outage. We went to the local pizza place and watched the baseball game until the power came back on, plugged in there.
No, cool. Thank you. Thanks for that. And great insights. Thank you very much indeed.
Oh, you're very welcome.
I guess a quick question, Johnny. Are you actually available past this time, or should we close?
Oh yeah, no, we're free to go.
Okay, okay. So there's a couple questions in the chat then, which is in terms of cost, did you have to pay for the device itself, and like what were the sort of costs in the maintenance or day-to-day aspect of the total artificial heart?
That I had insurance. Insurance covered it. It's you kind of sign like a rental agreement or something, in that terms. I never had any issues with the insurance questioning or anything. They covered it. Everyday cost would be just the same as my monthly checkup. You go in and you do your pressures. They have you walk so many steps you can go, which I never had any problem with that because I was walking a lot anyway. So it would be just like a regular checkup. So your regular $55-$60 pay.
How often did you have to change your batteries, and was that process easy? Like throughout
Um,
the day, I mean, yeah.
I would say 2.5 hours, every 2.5 to 3 hours. I would change them unless I was plugged in. And so, like, say if I was in the car, I would plug into the cigarette lighters, or if I was sitting at home, I would plug into the wall. I wouldn't let it run constantly.
Yeah, thanks, Tony. Thanks so much for your time today. It's really quite inspirational to hear from someone like yourself and to take the time doing it. It really makes a big difference to those of us who work in this industry. And just a question, maybe a little more human interest than mechanical side of it at the moment. You got about doing things for 203 days, I think you said, using a mechanical heart. How did you feel putting your trust? I mean, you didn't have much option, I guess, while you were waiting for the transplant, but going out, playing golf, mowing the lawn, sort of laughing off having the unit getting hot and just swapping it. Did you find it was a huge leap in faith to put your trust in a mechanical person-made device? And did you feel relieved when you got the transplant?
Um, no, definitely relief in the transplant. Yeah, no, that's but I had all the confidence in the world in it. Yeah. My team, any questions I ever had, I called. The response was right there. Um, they made me feel comfortable, so I felt comfortable. Even when I had my first change out, my first change out was with my dad. He was 74, and I said, "Hey, come on, we got to change this out." He said, "What do you mean?" I says, "I got an alarm." And so we came over, and it's just, 1, 2, 3 now, and boom, we did it. And after that, there was no fear at all.
That's
No
great.
fear at all.
That's really nice to hear, actually. It's
That's
yeah. Thank you.